ideally, the best thing that can happen is for the patient, as they become an adult, to take over more and more of their own care and of their own life. And really that's growing up, isn't it? Is trying to figure these things out, and healthcare is the same. It shouldn't be any different. The time to do this is not the day before the transition. The time to start doing this, in my opinion, is as soon as the patient is ready to think for themselves. And that could be age 6, it could be age 8, it could be age 12. And I'd like to think of this as sort of an apprentice adult. Children need to make their own decisions to the degree that they can. If they don't make their own decisions until they're 18 and then suddenly they make all their own decisions, they're going to have problems. And so I think the more and more that our 14-year-olds and 16-year-olds and 17-year-olds are involved in their care, the better. Now, it's natural for parents to want to protect their child. I understand that. And there are some things from which I would like my pediatric patients to be protected. I don't want them to have to deal with some things, for example, because why should they have to? But trying to decide about different types of care, trying to decide about whether or not you would have this test or this procedure or that procedure. These things are important, and if they matter, then the child should probably be involved to the degree that they're ready for it. And so for them to have some command or some mastery of the transition summary document or the records, or know the providers, or even know the way to get to the doctor's office or the telephone number for the office. These are all things that they can practice. And as parents, what we can do with our young adults as they grow up is try to involve them and say, so what do you think we should do? Ask them, why is it that we're having trouble as a family eating, say, the right type of foods? Do you have any ideas about that? Or you might say, we have a choice today between going to the doctor's office like we scheduled and going to the zoo. Say the weather's really nice. You know, wouldn't it be nice to go to the zoo? But we sort of have to go to the doctor. And so these are the kind of decisions that we face as adults, right? And so it may not have ever occurred to that. And so if you can talk it out and be thoughtful about it, that's, I think, a good exercise to learn and to become more and more. If you're looking for a short version of what I just said, I think what we need to do to encourage our adolescent patients and our adolescent children is to ask, why are we doing these things? And which of these things do we want to do? And so if they can ask which and why, that's a great step to being an adult and to watching out for yourself. And that's something I would like to see for my children. I would like to see that for everyone else's children, and then and certainly for my patients into the future.